Welcome to the Cxbladder virtual dinner program. My name is Kristen Scarpato. I'm a urologic oncologist at Vanderbilt University Medical Center. We will review several specific case examples for Cxbladder this evening. But first, I'd like to start with a broad overview of Cxbladder. I think it's important to start with the economics of bladder cancer. And prior to diving into the economics, we have to think a little bit about epidemiology. Approximately 11 million patients will present with hematuria annually. This translates into over 4 million cystoscopies. As we know, the American Cancer Society puts forth estimates of incident cancer in the United States each year. And this year, over 81,000 new patients will be diagnosed with bladder cancer. Said another way, 1 in 42 people will be diagnosed with bladder cancer in their lifetime. This translates into bladder cancer being one of the most costly cancers to manage. The direct costs, so by direct costs, I am not including things like indirect costs of patient suffering or lost productivity. The direct costs in 2010 were estimated to be about $4 billion a year to manage urothelial carcinoma. The 2020 estimates show that number rises to almost $5 billion per year. That's pre-COVID numbers. Looking at the individual patients, the average lifetime cost is expected to exceed over $220,000. So based on the direct costs alone, again, bladder cancer is one of the costliest cancers to manage. And this is related to the well-established high recurrence rate, the low mortality rate for most urothelial carcinomas, and then the significant cost associated with disease surveillance. Cxbladder has been commercially available in the United States since 2013. This test is an objective genomic urine-based test, and is optimized to provide diagnostic clarity covering the entire continuum from hematuria through patients with urothelial carcinoma. This is a very helpful schematic, and we'll start at the bottom and work our way up. Within the hematuria pathway, there are 2 Cxbladder tests. There's Cxbladder Triage and Cxbladder Detect. Cxbladder Triage is optimized to identify low-risk hematuria patients, for example, patients with asymptomatic microscopic hematuria who have a low probability of urothelial carcinoma and may not require a full workup. You can see here a very favorable sensitivity of 95% with a high negative predictive value, 98.5%. Cxbladder Detect offers high sensitivity and high specificity, as you see here, and serves as an objective adjunct to cystoscopy. As you'll see later tonight, Cxbladder Detect can add objective diagnostic clarity for hematuria patients when you have an atypical cytology or you have discrepant results. And then finally, at the top of the schematic here, you see Cxbladder Monitor. This is a product that's to be used for patients who have a history of a diagnosis of urothelial carcinoma and are undergoing surveillance. With a high sensitivity and a high negative predictive value, Cxbladder Monitor can identify patients with a low probability of recurrence to help extend intervals between cystoscopy for appropriate patients and also increase overall compliance within the surveillance protocol. Without getting into the specifics, Cxbladder has been extensively studied, and the validity of Cxbladder Detect and Triage within the hematuria pathway has been demonstrated in multiple high-regarded peer-reviewed publications, as you can see here, Journal of Urology, BMC Urology, and European Urology. Similarly, Cxbladder Monitor has been extensively studied within the surveillance pathway, and the validity of Cxbladder Monitor has been demonstrated in multiple peer-reviewed publications, as shown here. One of the case studies that you'll hear about tonight focuses on the use of Cxbladder in the adjudication of atypical cytology. The objective of this study is to evaluate the performance of Cxbladder and urine cytology and Cxbladder's adjudication of atypical cytology and equivocal cystoscopy. In this study, 852 patients had both Cxbladder results and local cytology results available. 18% of those patients had atypical cytology by their local pathologists. Cxbladder correctly adjudicated 153, so all results, all atypical results. There were no false negatives. Furthermore, 47 of these 153 atypical cytology results were correctly ruled out by Cxbladder. Within this population, 14 samples were atypical and the patient had an equivocal cystoscopy, and Cxbladder was able to correctly adjudicate all of those, including 2 samples where the patient had invasive urothelial carcinoma and 1 patient who had high-grade CIS. We can conclude from this study that Cxbladder correctly adjudicates patients diagnosed with urothelial carcinoma among those with atypical cytology and an equivocal cystoscopy. And Cxbladder demonstrated superior performance when compared to cytology for accurately identifying patients who do not have urothelial carcinoma. Another case study that we'll hear about tonight focuses on the use of Cxbladder monitor in the surveillance pathway. This was published in 2020 in BMC Urology. And here is a quick summary. This is a real-world use study demonstrating the clinical utility of Cxbladder monitor in the surveillance of patients, again, with a known diagnosis of bladder cancer. These patients initially were risk stratified as high risk or low risk based on their history of urothelial carcinoma. And then urine was evaluated using Cxbladder monitor. And patients were then surveyed based on the results of those 2 findings. It's important to note that clinical utility of Cxbladder monitor in this study was based on the number of cystoscopies avoided under the new protocol compared with the former surveillance protocol in which all assessments were by cystoscopy. You can see that Cxbladder monitor accurately ruled out almost 80% of patients who did not have pathology confirmed urothelial carcinoma recurrence. And this was regardless of that initial risk classification as high or low risk. There was 100% sensitivity of Cxbladder monitor, so not a single tumor was missed. And during the longitudinal evaluation, 35 months, Cxbladder monitor did not miss any high-grade tumors, and no patients progressed either to muscle-invasive disease or to metastatic disease, and there was no cancer-specific mortality. So we can conclude from this study that Cxbladder monitor can reduce the cystoscopic burden in certain patients, can obviate the need for risk stratification based on clinical parameters, and finally, can allow us to identify patients who are at higher risk of recurrence regardless of when they were originally diagnosed with urothelial carcinoma. Another great benefit of the utility of Cxbladder that became extremely helpful during the COVID-19 pandemic was the use of Cxbladder in-home sampling. This allowed patients to undergo Cxbladder testing all from the comfort of the patient's own home. What we're able to see with Cxbladder in-home sampling is improved compliance for non-muscle invasive bladder cancer patients who are undergoing monitoring. This also translated into improved clinic and procedure workflow. And this is because patients who are identified as low probability were able to delay action. And then finally, Cxbladder in-home sampling adds clarity and clarifies equivocal hematuria workups. So this is just a brief overview of our program. I know you will enjoy it, and I look forward to answering any questions. Thank you.